number 1. Patient after endoscopy found tumor in stomach, mild lymphoma, and he has H. pylori positive. What to do? Answer is antibiotics. This patient has H. pylori infection which has resulted in mild lymphoma, which is basically a tumor of the stomach. The first line treatment for mild lymphoma is antibiotics and not surgery. Antibiotics are given to eradicate H. pylori. In 80% of the patients, mild lymphoma responds to antibiotics, and it is the only tumor in the body that responds to antibiotics. MCQ number 2. Smoker has chronic GERD. Upper scope was done and showed high-grade dysplasia. What is the management? Answer is refer for possible esophagectomy. If there is no dysplasia, give only PPIs. If there is low-grade dysplasia, give PPIs and do endoscopy every 6 months. If there is high-grade dysplasia, do mucosal resection via endoscopy or consider even surgical esophagectomy. MCQ number 3. Patient heavy smoker with symptoms of GERD. Upper endoscopic examination shows squamous cell with high-grade dysplasia. Next step in management is, answer is endoscopic mucosal resection, as we discussed previously. MCQ number 4. 58-year-old male came with symptoms of peptic ulcer with weight loss. What to do? Answer is urgent referral for upper endoscopy. Peptic ulcer can result in gastrinoma, and weight loss is a red flag which indicates that this patient may have gastrinoma which has been caused by peptic ulcer. So do urgent endoscopy. Whenever you see weight loss in an MCQ stem, always consider tumor. MCQ number 5. Adult patient came to ER with substernal pain for 1 hour, not radiated to other tissue, with previous attacks 2 weeks ago, last for seconds only. The answer is GERD. It is not MI for 2 reasons. Number 1, the pain does not radiate to left shoulder, left hand or left jaw. And number 2, the pain comes and go. And it is not pericarditis because the pain is not continuous. The symptoms of GERD come and go and they do not radiate. Here are symptoms of GERD. It can cause chest pain, which can mimic angina or MI. MCQ number 6. Patient was having GERD symptoms and on PPI 40 mg, and his symptoms controlled. He stopped the medication 4 months ago, and symptoms back again but worsen. All labs and physical examination is normal. What to do? The answer is give higher dose PPI. According to NICE guidelines, if the patient is having severe GERD, give standard dose PPIs, that is 40 mg. If the symptoms reappear, give higher dose PPIs, that is 80 mg OD. In mild symptoms, give antacids. In chronic and frequent symptoms, give H2 blockers or PPIs. And in severe symptoms, the first line is PPIs, and if refractory, then Nissen fundoplication. MCQ number 7. Patient with GERD being treated. What is the indicator of good therapy? The answer is clinical symptoms. GERD is diagnosed on the basis of clinical symptoms, and the indicator of good therapy is also clinical symptoms. MCQ number 8. With persistent symptoms of GERD despite treatment with PPIs, what is the management? The answer is increased dose of PPIs. If there is partial response to PPIs, increase the dose. If the patient is taking PPIs 20 mg OD, increase the dose to 20 mg BT or 40 mg OD. If the patient still does not respond, then do 24-hour pH monitoring or endoscopy with biopsy to rule out alternative diagnosis, for example, esophagitis. MCQ number 9. Dark stool with medication of GERD. What is the likely cause? Answer is bismuth. MCQ number 10. Morbidity GERD with obese. Actually, this patient is obese and he has GERD. So, what is the management? The answer is RON-NY gastric bypass surgery. In this surgery, we bypass part of the stomach and duodenum and connect rest of the stomach with the jejunum. It is one of the main surgeries by which the patient can lose weight. What is indication for this surgery? When diet and exercise fails to reduce weight, or if the patient is having morbidity along with obesity, for example, GERD. In this case, the patient is obese and he has morbidity, that is GERD. So we will do RON-NY gastric bypass surgery. MCQ number 11. Patient diagnosed with GERD taking Omiprazole 20 mg and not improving. What to do? Answer is increase the dose to maximum 40 mg twice daily. We discussed it earlier. If the patient is not responding to 20 mg, increase the dose to 40 mg or even 80 mg. And if the patient still does not respond, then do 24 hours pH monitoring or endoscopy with biopsy to rule out alternative diagnosis, for example, esophagitis. MCQ number 12. GERD, the main risk factor for esophageal carcinoma. Basically, this question is stating that the patient is having GERD. What will be the main risk factor for esophageal carcinoma in this patient? So, GERD can cause Barrett's esophagus, which can result in esophageal carcinoma. MCQ number 13. Case of 70 years old man who is a heavy smoker, and he came with melena and abdominal pain and weight loss. Labs are unstable. Answer is cancer of esophagus. The 3 red flags of esophageal cancer are age more than 50 years, smoker, and weight loss. All these 3 red flags are given in the statement.